Hey, what's going on everybody? I am Dr. Caban and welcome back to the channel. I am a board certified general surgeon and a fellowship trained bariatric surgeon in Ocala, Florida. And today I'll be talking to you about the most common weight loss surgery done in the United States in the last several years, the sleeve gastrectomy. Now, before we get into the weeds of the sleeve gastrectomy, don't forget to subscribe to the channel so you can get notified about future videos. I'll be doing more videos about other bariatric and general surgery issues that might be of interest to you. If this is the first time that you do any research about bariatric surgery, you might want to check out some of the previous videos on my channel. They will help you figure out if you qualify for surgery or how to know what bariatric surgery is best for you. I also have a video about what you need to do before bariatric surgery. See the links in the description below. Okay, so let's get started with what is the sleeve gastrectomy or the gastric sleeve. It is also known by some patients as the stomach stapling. The sleeve gastrectomy is where approximately 75 to 80% of your stomach is removed in order to make it smaller. This will restrict the amount of food that you can eat and subsequently triggering weight loss. The surgery is done laparoscopically or robotically. What that means is that it's done through several small incisions in your abdomen, and with a TV screen and some fancy little instruments, the surgery is completed that way. By doing the surgery this way, the patients experience less pain, faster recovery, and significantly fewer complications. The surgery takes around 45 minutes to an hour and is done under general anesthesia. Surgery time is highly dependent on prior abdominal surgeries or your current weight. A gastric sleeve on a 600-pound patient will take longer and it will be more difficult than a sleeve gastrectomy on a 300-pound patient. In most bariatric programs, including mine, the patient will stay in the hospital overnight. After discharge from the hospital, I'll see you back in my office in 2 weeks. After that, you will follow up with me every 3 months for the first year. Most patients will follow up with me once a year thereafter. Probably by now you're wondering, okay, that's all great, but what about the weight loss? Well, the average weight loss after the sleeve gastrectomy is around 60 to 70% of your excess body weight in around 1 to 1.5 years. Let's calculate the excess body weight of our favorite patient. Her name is Debbie. We talk about her in some of the other videos. Based on her height, she should weigh around 150 pounds. That is her ideal body weight. Debbie's current weight is 350 pounds. That means that her excess body weight is 200 pounds. That is the difference between her ideal body weight and her current weight. So on average, she is expected to lose 60 to 70% of those 200 pounds that she has in excess. That is around 120 to 140 pounds. And she should expect to lose that in around 12 to 18 months. Remember that this is an average. Some patients will do better and others will do worse. I did a full video about figuring out what bariatric surgery is best for you. I went over why some patients might do better than others with one surgery versus another. Check out the link in the description below. Now let's talk about some of the pros of the gastric sleeve and why it has become so popular around the world. Number one is simplicity. The sleeve gastrectomy is a relatively simple surgery to do, and the surgeries to your anatomy are minimal. That makes it very attractive to many patients because it doesn't change your anatomy that much. Number two is a short hospital stay and a quick recovery. By doing the surgery minimally invasive, patients go home after one night in the hospital and they can return to their regular activities very quickly. With implementation of the fast recovery protocols before and after surgery, the patients are experiencing less pain and the use of pain medication has significantly decreased. Some patients will go home without taking any pain medication at all. Patients that have an office job can go back to work after 2 weeks on average. For patients with more labor-intense jobs, they will be out of work between 4 to 6 weeks. Number three is excellent weight loss. The combination of surgery, an adequate diet, and moderate amounts of exercise should give you excellent long-term weight loss. Remember that the sleeve is not a one-size-fits-all, but on average, most patients will see an excellent weight loss after the surgery. Number four is low complication rate. I have been a bariatric surgeon for 10 years at the time of this video, and my overall complication after a sleeve gastrectomy is less than 5%. That is well below the national average. Please remember that past performance is not indicative of future results, but when the surgery is done by an experienced weight loss surgeon, the risk of surgery is very low. But as you already know, nothing in life is 100% peaches and cream. That is also true for the gastric sleeve. It is also true for pretty much any surgery. I am going to make a video in the near future about the complications that can present after bariatric surgery, but for now, I am going to mention the biggest disadvantage of this surgery. That disadvantage is that the gastric sleeve is irreversible. After the portion of the stomach is removed, there's no going back. The sleeve cannot be reversed. It can be converted to a gastric bypass or a duodenal switch, but it cannot be reversed to a normal stomach. That can be a deal breaker for some patients, so you need to know about it. Now, if you watched my previous video about the lap band, you probably remember that the lap band is completely reversible. That is a big difference between a lap band and the sleeve gastrectomy. As I mentioned before, I'll be making a full video about the complications of bariatric surgery, including those of the sleeve gastrectomy. If this is of any interest to you, don't forget to subscribe to the channel so you can be notified when other videos are posted. I hope this video was informative to you. Remember that if you have any questions, please leave them in the comments below and I'll be happy to answer them for you. Thank you for watching and I'll see you on the next video.